Good evening. Glad you're with us. 19 months into the COVID-19 pandemic, and the effects of isolation are taking a toll on those most vulnerable, our kids. The American Academy of Child and Adolescent Psychiatry, along with the Children's Hospital Association, have declared a national emergency over children's mental health, in large part due to the pandemic. Our Tristan Lewis joins us in studio now. He took a look at this data. Tristan, mental health is so important. How are things shaping up here in Idaho?
Well, Kim, according to the Mental Health America's annual report, Idaho actually ranks second to last when it comes to prevalence of mental illness and access to care and resources. Mental and behavioral health groups in the Treasure Valley want to fix that. They're pushing to create a larger conversation among people on the topic of mental health, especially when it comes to kids.
I've been with North Point employed through North Point for almost 2.5 years.
For Tucker Bricky, recovery and treatment have become a large part of his life. That's because it's helped him to be able to live his life.
But I've been with North Point. I went to the inpatient facility for drug and alcohol rehabilitation back in 2017.
Bricky began using drugs and alcohol when he was 16 years old, which turned into an addiction that lasted more than 20 years. He used it as a way to cope with depression and anxiety.
Some of my earliest memories were, my mother called them funks, where it would be sometimes days, sometimes weeks, where I would just get really quiet, go into deep depression.
Growing up in a small community 30 miles west of Portland, Bricky didn't feel there was any education or resources out there to guide him on his mental health journey.
My parents, they were loving, they were supportive, but I don't even know if we really knew what depression and anxiety was.
While Bricky eventually discovered tools for his depression and anxiety as an adult, there are still many out there who haven't, especially kids. According to Mental Health America, 60% of youth with major depression are not receiving treatment.
With a lot of the sort of generational stigma attached to mental health conditions, for lots of reasons, people don't talk about it.
Nicole Warner is the director for North Point Imagine, which is a program for kids ages 12 to 17 who suffer from mental health challenges.
We offer a partial hospitalization program for them that is a day treatment program that allows them to get help for their mental health during the day and then go home with their families in the evening.
The Imagine program is seeing anywhere between 15 to 25 clients a day at each of its facilities, which is the max. Warner and her team say they have seen an increase in anxiety, depression, and even suicidal thoughts, which she says comes from the isolation that's come out of the pandemic. Warner also says those left untreated sometimes turn to substance abuse or other damaging outlets.
I can't imagine having to go through that, especially having the anxiety and the depression that I had, how much worse it would have been.
She sees the discussion surrounding mental health improving, but she says there's still a long road ahead to ending any stigma behind it.
Ask questions, keep the conversation going, and there's lots of resources online in terms of talking points and ways that you can approach those conversations.
Is that something that you would have wanted your parents to see when you were 15, 16, asking questions?
Yeah.
And Warner wants to emphasize for those who are worried about someone in their life, whether it's a child or an adult, ask them if they're ever having negative thoughts like suicide. She says it will never hurt to ask. The National Suicide Prevention Hotline is on your screen, 1-800-273-8255. It operates 24/7 in English and in Spanish. Kim?
Keep those communication channels open. And I really thank Bricky for opening up and sharing his story with us. I think that takes courage, and hopefully people will learn from that. And he wanted his parents to ask those questions.
Exactly.
All right. Tristan, thank you.